Hi, everyone. Thank you so much for joining us today for Riverside Community Health Foundation's Community Q&A episode, where we are going to invite different experts to answer your questions. My name is Bianca, and today your questions will be answered by our resident doula, DEIDRE COUTSOUMPOS. Today, you're going to learn about what doulas offer and find out how you may qualify for free doula services. Make sure you like and follow us on Facebook and Instagram for more great conversations. Now, I'd like to introduce you to our guest, DEIDRE. For the past 15 years, DEIDRE COUTSOUMPOS has served families during their childbearing years by helping prepare their hearts, minds, and bodies to welcome their new babies, while also birthing themselves as new parents. DEIDRE currently has the privilege of mentoring and training new doulas and childbirth educators. She also holds the honor of coordinating and managing the IEHP RCHF Doula Access Program. This program provides free doulas services to IEHP members. Welcome, DEIDRE.
Thank you. It's very exciting to be here in this capacity. There's so many things that I couldn't have dreamed or conceptualized, and like to be sitting in this place, like listening to that bio, I'm like, oh wait, that's me. That's very exciting. Very, very exciting. So thank you for having me, Bianca, and thank you for having me, RCHF, in more than one way.
Wonderful. So we have a few questions we want to ask you. What is the difference between a midwife and a doula?
This question is one of the most common questions that doulas receive across the board. There is a misconception and like this confusion between a midwife and a doula. And the big difference is that a midwife is more synonymous with an obstetrician. So obstetricians and midwives, they do the same job. They take care of mothers physically and medically during the process of pregnancy, labor and birth, and then in that postpartum period. Midwives also provide well women care. So like the annual pap smears and things like that, midwives can do for women, and those who identify, yes, for women, and can make sure like all of those things are going really well. Doulas, on the other hand, are non-medical trained labor and birth professionals. And what they do is provide informational support, physical comfort, and emotional support during the childbearing years. So from the time a person gets pregnant, throughout the pregnancy, physically they're present during the labor and birth if they're a birth doula, and then in the postpartum period, which brings a lot of challenges and shifts and growth, just like we heard a few moments ago. When a family has a baby, they're not just birthing a baby, but they're birthing a part of themselves as a new mom, as a new parent, and that comes with its own challenges. So a doula is very much to provide emotional support, informational support, and encouragement during that childbearing year. Like I always tell people, when we're physically together, doulas are all up here, and midwives and OBs, they're all down there. That's their job. So they don't deliver babies, they don't make sure anything's going well medically, but really making sure that mom's mind, heart, and then physical comfort is their highest priority.
Thank you.
Yeah.
So we have some more. We know you went into some brief about what does a doula do and what does a doula not do. Could you expound a little bit more on that?
Absolutely. So when it comes to the work of a doula, there are some core trainings that doulas have to go to, whether they are going to a community-based training or a national training, but that is there is a clear line and a code of ethics that doulas tend to follow. And it's number one, there isn't a crossover. When a doula is in the role, or when a person is in the role of a doula, they are providing this informational support. And so let's break that down a little bit more. Informational support means that even though a doula is not a non-medical labor support person, they know a lot about the physiology behind pregnancy and how labor and birth works, how the baby moves down and through the bones, and how to get moms in different positions, what might feel good on a mother's body in terms of massage, how water might affect labor. And so they might be physically comforting mom in that way with all of those things that I just mentioned, but they are not checking the cervical dilation. They are not checking the baby's heart rate. They are not delivering babies, but they do make moms feel really good and comfortable. When it comes to the emotional realm of a doula, midwives and doulas have that same philosophy. So not to get a little confused, but we really try to practice whole person care. And that means checking in with what's going on with your mind and your heart. How are you feeling? Like, how are you feeling about this pregnancy? Where do you have any anxieties, any doubts, any things that you're afraid of? And not that doulas are psychologists, but there is a strong connection between the mind and the body, and how that mind and body have to work together. And so this emotional support means reassuring the parents, giving encouragement, giving maybe small suggestions on how to cope maybe during the pregnancy, and then also how to mentally cope during the labor and birth as well, to make sure that everything's going a little bit more smoothly. But doulas do not prescribe mental medication. They do not diagnose mom with a maternal mood disorder. They do not tell people what to do when it comes to the process as well. And then with that last piece, informational support. And informational support means that, like we said before, they know a lot about the process. And so a lot of times in my experience, I've heard families saying, well, I'm good, I'm just gonna do whatever my doctor says. Okay, that's one way to have a baby, absolutely. But we really find that emotional trauma happens not necessarily because the experience is physically traumatic, but we find that emotional trauma happens when somebody doesn't feel like part of the process, like they feel like their modality of choice was taken from them. And so the doula's role is to provide them with information so that family can make sure that they have all the information to make the best decisions for themselves during process and labor and birth. And if they would make this decision in conjunction with their care provider, with their midwife or with their obstetrician. It's not like, so doulas do not tell people what to do and say, this, and this is what you should do. That's the end all be all. The other things that doulas do not do within that informational realm is give their own opinions about about what they think is important. Doulas are here to lay out all of the different options and say, look, this is like a buffet. You can kind of pick what you want in some regards, and then in other regards, we're just going to have to go with the flow. And if that happens, I will roll out some options for you. If the circumstances or however the labor and birth unfolds, and that kind of takes away some of those options, what else can we do? The main thing that doulas really do during the process of pregnancy and labor and birth and in that postpartum period is, what does it look like to stay here grounded in this moment? What does it look like to stay here? And if we're staying right here in this moment, we're not thinking too much into the future, which can kind of get people riled up emotionally and mentally. And if we're not getting too stuck in the past, which can kind of activate that idea of suffering, which kind of can increase our physical intensity. Doulas are just like, okay, let's stay right here, right now. And if we stay right here, right now, this can lead to good outcomes. This can lead to this release of suffering. It can also lead to minimizing some of the pain that sometimes parents face during the process of labor and birth.
Wow, thank you.
Yeah. Mm-hmm.
So with that being said, what kind of training does a doula have?
Yeah. So doulas, when it comes to training with doulas, like I said, there's a few different paths to becoming a doula. There are international organizations that train doulas, and then there are community-based doula trainings. And so generally they both offer the same kind of basics, like talking about the physiological process of pregnancy, labor and birth, and what happens in the postpartum body. They learn skills and techniques of what good labor massage looks like, different positions that a family will be able to utilize. They also learn about the interventions or the hospital support options that a family might encounter, whether they are routine hospital support options or interventions and or non-routine. And then a variety of different other modalities, like to help and support families during that time. And the big difference between the international trainings and these community-based trainings, the international trainings, because people can go, like I could go to a training in Georgia from one of these international organizations and get the same information if that training was held in Texas or in Louisiana, right? Or somewhere else in the country. But it gives me like the basics about what to expect, how to navigate in the hospital system, because especially in America, like our hospital systems tend to run about the same. But when a person is going to a community-based doula training, they get those overall basics that somebody would pick up at one of those organizations. But then they also get some specifics based on the community that they are living in. Generally, community-based doula trainings happen in a community where they're going to actually serve that community. So so those different kinds of trainings with the community-based training, the other big difference is instead of having one trainer over a few days, you'd have multiple trainers, multiple people from the community who serve that community from different arenas. So for example, I hosted a training last year, a community-based doula training in Riverside, and we had a mental health professional whose specialty was maternal mood disorders. We had a childbirth educator, and then we had a doula, and then we also supplemented with midwives and lactation consultants and nutrition people. So the education that I really believe that community-based doula programs are getting is actually more well-rounded, and then also really preparing people to serve that community, knowing who they're serving, knowing what the challenges and barriers there are in those communities, and then also really giving those doulas a strong amount of tools to walk away with, and then also giving them a network of support and mentorship opportunities as well.
That is so inspiring. Wonderful. Cool. Now, does a doula replace my partner?
Ooh, tons of times moms and partners are really concerned about, like, partners like, well, if the doula's there, am I even necessary? And then moms are like, but I want it to be an intimate experience. It was just the two of us that made this baby, or the two of us who intended to make this baby, depending on how babies get made for each family. So the short answer is that doulas do not replace the partner at all. There is a special magic that a partner brings that only that partner can bring. You know, the inside jokes and the looks and the squeeze of the hand means something. It's like their special language that two of them have together. But a doula is there because it's really not just a mom who's birthing a baby. A mom is birthing herself, or a birthing person is birthing themselves as a parent, and then the co-parent is also birthing themselves as a new aspect is being born. And if we bring to mind, like, if you've ever seen labor and birth, even on television, where they really do their best to dramatize it and make it either super hilarious or comical, it's really not always like that, but it is a difficult process. Even if it's not the birthing person, it can be a very emotional process, a very mentally taxing process. Labor on average is about between 18 and 24 hours, sometimes longer, occasionally shorter. So it is physically grueling, and we're asking people to stay up and be attentive. And so having a doula is like having like a professional to tag team with. Not only can a partner be reassured that all the pressure is not on them, a partner can also be reassured in the fact that if they forget something, or if they are tired, their person isn't going to be alone. And really, I would like to say that doulas really make partners look amazing. Doulas are there to whisper, why don't you try this, or touch your back like this, or do you need to go to the restroom, or you're looking a little peaky, have you had water recently?
Right.
So the doula's there to take care of both of both the birthing person and the partner during the process, because it's very taxing. And the other thing about having a doula, having a third-party person who is not emotionally attached to the couple, because sometimes people are like, well, can't I just bring my sister, or my mom's going to be my doula? Ideally, that would work beautifully. But anybody who is emotionally attached to that birthing person is going to have their own birth experience. So perhaps the grandparent is birthing themselves as a grandparent, or that, that best friend or sister is going to be birthing themselves as an aunt or an uncle. And that can be really taxing on the mom when she's like, everybody's crying, I'm not sure what to do, and I know I need to do this labor thing, but I should probably take care of my support people. That is not the job of the birthing person, not at all. So we really, because the doula is a third party who is not necessarily emotionally attached to that family, they can kind of operate under a different energy to help everybody stay focused, to kind of see things in a different way, and not just through this lens of how emotionally attached they are to that parent.
That is so good to know.
Yeah.
So the next question, do I have to give birth at home in order to use a doula?
Yeah, that is a great question. Again, a lot of our childbirth education starts way before we get pregnant.
Yes.
It can be from stories that we've heard about ourselves, or maybe our cousin gave birth, or we heard the story of us being born told, or we catch it on television or in movies, and especially in entertainment when it comes to doulas. A lot of times, well, a few times I've seen them fairly, especially more recently, like more mainstream, but like doulas are like woo people that like do like witchcraft or magic. And that's not really how they work.
Right.
Because a doula is not a midwife, and even with a midwife, you can deliver your baby anywhere. The doulas go where the parents go. And so if a parent is choosing to birth in the hospital, the doula will go with the parents to the hospital. If a parent is choosing to birth in the birth center, the doula will go to the birth center. If a parent is choosing to birth at home, then the doula is going to be supporting the family at home. And because they don't deliver babies, they go wherever the birthing family goes.
That's good. And then, does a doula bring her own expectations to my birth?
A lot of times people have a lot of wariness around this. Sometimes it can be anxiety inducing, where they're trying to like, oh, what if I don't meet my doula's expectations? What if I get an epidural? Or what if I have a cesarean birth? Or what if I don't want this thing? You know, if they think that they're, okay, here it goes. Sometimes the story that we tell ourselves about the story someone else has just kind of like gets all mucked up in our minds, right? And this is just makes us like, oh my gosh, it creates more anxiety inside of our body. But when it comes to having doula support, the doula is like, if we just had a blank sheet, it's going to stay blank, essentially. The doula does have a lot of training. The doula does have her own personal philosophy around how maybe she would do it for herself. But generally, the doula's philosophy when it comes to serving a client, the main focus of the doula is, what does it look like to stay right here in this moment? What does this moment need? How can I bring comfort or love or support to this family right here, right now? Not 3 contractions in the past, not 10 contractions in the future. And so in order to stay present, we really have to allow ourselves to let go of expectations. Even though a doula might be thinking, it's been a while since we've gone to the bathroom, or maybe we should change positions in the next 10 minutes, or, oh, she's saying she's feeling a little pressure. Maybe this will help to alleviate that. Yes, they're thinking a few steps in the future, but they're not trying to predict the outcome for the future. And when we allow that prediction for an outcome to be relinquished, then it really gives the doula freedom to stay in this moment and have no expectations for that family. And again, on the other hand, people are human, but in general, expectations for a family, that a family should do a particular thing.
That's good to know. And I believe there's a follow-up to this question right here. Are doulas only for unmedicated births?
Yeah, that's a great question as well. It does go along with this expectation. A lot of times families do say, okay, well, this is the kind of birth that I want, or this is the kind of birth that I want. So part of the doula's role is to help families let go of those expectations, including having an unmedicated birth or embracing an unmedicated birth. Doulas can really be present for whatever birth brings.
Right.
So the short answer is no, doulas aren't just for unmedicated births, but they can be really helpful if that's a family's goal, to not have medication. And when we say medication, generally we're talking about pain management, pharmaceutical pain management, like an epidural or a narcotic that can be offered during the process of labor and birth. But then also sometimes on the converse, and I've experienced this a few times in my personal practice, where families are like, I'm just gonna back right up into that labor and delivery, and you're gonna give me that epidural as soon as I can have it. And sometimes that's not possible for a variety of situations. Sometimes the family gets there and the baby's like literally ready to be born, or a mom's like, I'm coping better than I thought, I'm coping better than I thought, I'm coping better than I thought, and then she's like, no, I'm not coping. But the reason she's not coping is because the baby's right there. Or sometimes, you know, the anesthesiologists are not available like right this minute, and we have to wait for a period of time. So a doula can really help on the flip side and with the expectations of the family. If they think, okay, well, my coping is having epidural, that's my plan. Okay, well, what happens when that doesn't become possible? And how can we, as doulas, again, keep that mom or keep that birthing person present in this moment as we're trying to move through and navigate what our options are right now?
That makes a lot of sense.
Mm-hmm.
Let's see here. So, for example, I'm getting an epidural. Can I still use a doula?
I guess we preemptively answered that one a little bit. So the short answer is, of course, you can have a doula. Doulas are perfect for all kinds of birth, which I think we'll talk about a little bit later. But a lot of people think, okay, well, if I manage my pain, what do I need help with and support with anyway? Well, that's great, because you know, epidurals do a great job of helping to cover physical discomfort.
Mm-hmm.
And that is the job of the epidural, to cover physical discomfort. But like we said before, the role of the doula is actually threefold. And, you know, if we talk about it, they have a few other jobs too outside of it. But so maybe mom's now experiencing physical comfort, but now the doula would step into the role of providing and putting all of her energy and attention to creating emotional support and informational support during this time, now that that physical component is no longer. And even then, when a mom gets an epidural, a doula might massage her feet. A doula might say, like, you see moms like, okay, I'm not having any contractions anymore, I don't feel, but they're still really tense through their shoulders and their neck. How do we relinquish that? The epidural is a wonderful tool to help people sleep during labor and birth. So how do we get mom to that place? There will be sometimes for families, now that we don't have to cope physically any longer, or with that physical discomfort of the contractions, now I can kind of maybe my ramps up. Maybe I start having conversations. It's kind of like a little nerve-wracking. So this is another place a doula can be really helpful to kind of relax and all of the levels. And or another situation might come up where more information is needed. The doula can encourage that family to ask the right questions so they can get the information they need and make a good choice with their provider. So the short answer is yes. An epidural does not negate the need for a doula, but there are other ways that a doula can be very supportive to that family, especially if partner's also very tired. Then partner can go to sleep. Then the doula's kind of like in the corner watching like a little angel. I tend to, when that happens with my clients and they have epidurals, I always have a little knitting project that I'm working on, so I can always like look up. If she opens her eyes, I'm right here, so she can just know, okay, they're looking out for me, and then I can like put my head back down if need be.
That is so cool. Next question. Do I need a doula if I'm having a cesarean birth?
I bet you all of our watchers already know the answer to this by now, but we'll go into a little bit more. So the short answer is absolutely. Even in a case of a planned cesarean, families might decide to utilize the services of a doula. And then how a doula would be helpful, especially if a planned cesarean becomes necessary. And there are a variety of different reasons why it might be planned. And then, of course, there are plenty of scenarios where the cesarean might be unplanned, right? But if a family knows that they were going to need a cesarean, then a doula can be helpful, in preparing the family to know what their options are. How can they have a more family-centered experience, to help them create a postpartum plan, to help them create more community support. Is some of the things that a doula might do on the prenatal side to help prepare the family to be ready for the cesarean birth. Doulas can actually go to the hospital if a family's having a cesarean. Now, even though they can go to the hospital, during COVID, it's a little bit more iffy, but regardless, even in the times where we're not having a pandemic, a doula, one support person is allowed into the operating room with the birthing person. So with that in mind, how a doula can be helpful is a doula can help on the preparation side once the family gets to the hospital. If a mom is very nervous, help calm her, remind the partner all of the things they can do to stay connected with the partner during the process, what to expect, all of the things they would have talked about prenatally. And then in the postpartum period, depending on the circumstances, a doula might be able to help that family breastfeed, help them through the golden hour, help them in that postpartum period. And then a lot of the care would be focused on the postpartum after the family gets home from their birthing place or gets home from the hospital, in this case, to help with more postpartum chores, help making sure that mom is getting comfortable. They can make suggestions about how to improve healing, and really to really help that mom be able to give all the gentleness and love she can to her body so that it can come back together to meet her family's needs and her own needs absolutely as well. So the short answer is yes.
Thank you. Okay, so How will I know if a doula is a good fit for me?
Yeah. Oh, there's so many ways to answer this question. The first thing that comes to mind, and the first thing that I think is very important now, if a family, sometimes families are like, okay, that's nice, that's not for me at all. There is a philosophy out there that's very popular among the doula community. Like, we want to make sure a family it's a doula for every family who wants one. If a family doesn't want one, it's not like, okay, well, you're weird. No, it's just not a good fit for you, and that's okay. But if a person is looking for a doula, we suggest, if they have that ability to select the doula that will work best and for them and with them, is when a family is interviewing them. Generally, families can interview doulas first, and you can easily Google, doulas in my area. Sometimes it would generate a great list, and sometimes it might generate Yelp replies or whatever. But a lot of times, the best way that I know that people get referrals is from, oh, my friend had a doula, or my friend had this doula. But even if your friend has this doula and that particular person becomes highly recommended, what I strongly encourage birthing people to do is, when you're interviewing a doula, so you're talking with them on the phone, and of course in this age, maybe you're doing a video chat, we highly recommend that you don't just listen with your ears, but you listen with your belly, with your gut. If you feel comfortable and safe, and being with this person in this way is helping you to be like, then most likely, when you're not on video chat and you don't have your clothes on and you're in the intensity of labor, that same sense will come over you in those moments as well. So you're really listening to, how does this person make me feel? What is standing out? Do I feel this sense of connection with this person? To know if this is a good fit when you're looking to choose a doula. And there are plenty of doulas in the world, and there are plenty of doulas in our area. And so if you're like, nope, that one's not for me, that's totally fine. If that person isn't for you, and you're like, oh, but this person has this many births and this much experience, and it kind of just really very connects with like your mind, like logically connects with your mind, but you don't feel that sense of connection with your spirit, then that is not going to be, that person being at your labor and birth will not be beneficial for you or for your support person at all. Because there'll be this sense of like, ooh. And really, labor and birth is a time where we really try to invite people in to let go and surrender as much as possible.
Wow. It's really good to know. So the next question, will a doula be there when I actually give birth?
Yes, is the short answer. The longer answer is, there are two types of doulas. We have labor and birth doulas, and we've got postpartum doulas, and sometimes doulas do both. So I'm a person who has a training in postpartum doula services and also in labor and birth services. And when you choose to have a birth doula, she is somebody that you would work with prenatally. They tend to have 2 to 3 prenatal visits for families to get on the same page, to help that family know and understand what is important to them, what everybody's role is, to do labor practice, all of those things. And so what happens is, when the mom or the birthing person goes into labor, that doula is actually on call for that client 2 weeks before and 2 weeks after that due date. So we have this window that's open where the doula is not gonna like go take a road trip or go hours and hours away unless something comes up, and then they would provide a backup. But the doula would be on call for that family. And when that family says, okay, we think we're having contractions, they would let the doula know right away. And it doesn't mean that the doula has to rush to that family's side in that moment. It just kind of helps it to get it on her radar, get on that doula's radar. Perhaps if that doula has a family, she might put her ducks in a row with child care. She might like throw her stuff in the Instapot, get her stuff together. And then whenever that family is ready for the doula to join them, then the doula joins them. Typically, a family would have that doula join them while they're still laboring at home, and then go on to the birthplace. Or sometimes the family just wants the doula to meet them at the birthplace, one way or the other. And the doula would actually be physically present, providing one-to-one support. So it's one doula per one family until the baby is born. And that could be 5 hours, 15 hours, 25 hours. Whenever that family is ready for that doula to join them, the doula joins them, and she stays until a couple hours after the baby is born. This is part of the magic about what doulas bring, is because they provide this one-on-one support, this one-on-one consistent support where they're not serving anybody else, unlike our OBs that have multiple patients, and the nurses have 2 to 3 patients as well. And then, there is this periodic checking in on with nurses in the hospital rooms, about 10 minutes out of every hour on average, where this doula support doesn't necessarily mean that that doula has to be in your space for all that time. The doula also takes care of their own needs. They step out, they take breaks. They're watching the dynamic of what's going on, and sometimes the doula will excuse themselves and say, like, I'm just going to hang out in the waiting room for a little bit, or maybe I'll sit in my car, be folks in space. I'm just a text or a phone call away. And that doula, is kind of reading the room in order to give that family as much support as possible. But having that one-on-one support, that's part of the magic that doulas bring to really give some of those good outcomes that doulas have.
That is so good. So at the follow-up to that question, when does a doula join me in labor?
Yeah. So a doula joins that family in labor whenever that family would like doula to join. Ideally before the baby's born. But sometimes family is like, well, I don't want to bother them, and I just don't want to, I'm not sure when I should call. But when a doula is working with the family, they always have their phone next to them. I'm just like, even reaching for my, it's always here. It's right here. We know where it is at any given moment. If that person needs they're there for texting support, phone calls, video chats, emails if need be. So it doesn't matter if it's 3 in the afternoon or if it's 3 in the morning, the doulas are ready. They are going to be ready to be able to answer that call whenever it comes up for that family. So it's whenever that family is ready for labor and birth. Now, this question might also be in reference, like, when in my pregnancy do I start looking for a doula? And when do I call a doula then? Like, how will I know? It's kind of the same. It's sort of the same. It's like whenever a family wants, but ideally earlier than sooner. I've had clients tell me, hey, I peed on a stick yesterday. Can you be my doula in 9 months? Sure. And then also on the converse, hi, I'm 9 months pregnant and I'm due in 2 days. Can you be my doula? Fine. Doulas are really flexible in that way. But ideally, in order to do some of the relationship building that we've been talking about to create a connection with that family, we would strongly encourage families to start looking for doula services around the middle of their pregnancy. So 20, 25 weeks, between 25 and 30 weeks is a great time to start looking for the doula, build a relationship with that doula. Just when things were starting to get over that hump towards the beginning of that last trimester is when we are, when it's a good time to look for doulas. It gives a family time to do some research. It gives a family time to maybe interview 2 or 3 different doulas and then make that connection so you can build a relationship with them. Yeah.
Speaking of that.
Yeah.
So the next question is, what happens if my doula is already with a client and I go into labor?
That is a great question. And that happens sometimes because we can't control this. Number one, the first thing is that generally doulas do not they're really good about spacing out their clients, and they know a little bit of because here we go, this is what I tell families all the time in my childbirth classes, the only thing that I can guarantee is that there are no guarantees when it comes to labor and birth and parenting. So even now, like I say that in this context, even though there's a little bit of a science behind how and when doulas take clients, it's a little bit like, well, we just never really know. So there's that piece. But if a doula happens to be in labor with a different client and that mom goes into labor, usually a doula works with a backup doula. And it's not that they just work with any old random, okay, doula Jane, you're gonna be my backup. No, they're just really intentional about picking somebody who kind of works like them, has that same philosophy that they have. And then something I do in my private practice is I have a few different backups. And what I do, if like a family chooses me, I kind of survey like their energy and the desires. And then I think about my backups to see not only who is available, but who might be best fit for this particular family in this role. So I know that doulas, they're really mindful. They have a really good sense of the clients that they work with. and they have a really good sense of the doulas in their community. So doula Jane might not be the best match for me, but maybe doula Dorinda is a better backup for me, because we kind of work in the same way, have the same philosophy, have the same vibe, for lack of a better word or term. And I trust, I've built a relationship with doula Dorinda to like hand my clients over just in case something happens, because we all know life happens and we can't always know what might come up at any given moment.
I feel you. So with all that being said, how does the Doula Access Program work?
Our Doula Access Program. Wow. We are so lucky at RCHF to be working with the Inland Empire Health Plan, one of our local public insurance providers. And the Inland Empire Health Plan, or IEHP, is providing and covering the cost of doula services to their IEHP Direct and Select members. Basically, anybody who doesn't have Medicare or IEHP Kaiser qualifies for this program. And how this program works, it works very similarly to what we've already talked about, how a family can actually, once they complete the intake process, and they would go to connectie.org, and you can put in doulas, and it will bring up the Doula Access Program information. You put in your telephone number and email address, and that comes to me. Myself or my colleague, we would complete the intake form. We ask some questions. In addition to intake questions, we also have some data questions that we're collecting, because currently it's in a pilot status, but we are hoping that it will move from that eventually. With data, we hope to prove that it's necessary. So once the intake completes, that client is given a list of doulas to interview, just 3. Even though we have quite a few doulas with our program, we don't want to overwhelm a family. And they would kind of do what we were talking about before, feel into this person, not just listen with their ears, but listen with their gut, to see if this could be a good fit for them and their family. And then once they choose a doula, they're matched with that doula. And that doula would provide 3 prenatal visits, doing all the things we've already talked about, building relationship, talking about expectations, releasing expectations, trying to get as prepared as possible for the process of our labor and birth. They would be on call for that mom, and they would support that family once that family was ready for the doula to join them, all the way until a few hours after the baby is born. And then with this Doula Access Program, the doulas are also providing 3 follow-up visits. And those follow-up visits happen a couple days after they get home from the hospital or the birthing place, wherever that family is choosing to birth. It would happen, the next visit would be about 2 to 3 weeks after the baby's been born, and then between 6 and 7 weeks after the mom has gone back for the postpartum follow-up visit. And that would conclude the professional relationship with that doula, which of course spans over a few months. And this does come free to IEHP members. And all you have to do, you can look us up on connectie.org, or you can even find us on, make sure we have a link, I think, in the comments. You can find us at rchf.org/doula access, and it will take you to that page, right to our doula access page on Connect.ie.
Wow, that was a lot of incredible information, Deidre. You like literally just made my moment, and I'm sure for everyone else here. So thank you so much for joining us. Yes. And Deidre, your insight, your inspiration, your knowledge about doula care, incredible. And
thank you.
Yes, thank you.
It was really a pleasure to talk about this, and really, I could talk about this all day long.
No, this is great. Yeah. This is great. And to our community, thank you so much for joining us today. And remember, we'll be doing more community Q&A series on a regular basis with different experts such as Deidre. And so make sure you like and follow us on Facebook and Instagram for more great conversations. Please visit our website at rchf.org and DM us if you have more information you'd like to know about, and especially about our Doula Access Program, and see if you qualify for free doula services. Thank you and have a great day.